doing today?
I'm good. How are you?
I'm good. So this is going to be our third session, which is our last session. So also, first things first, I want you to show me how you've been using your techniques at home. So we could start off with the toothbrushing.
Okay.
And you're using that 45-degree angle that we were talking about. Do you know what the method was called?
The bath?
Yes, the bass. And then you're also getting in... Yes.
Under
here. Under... Yes, that's perfect. And do you know how long we're supposed to be brushing our teeth?
At least 2 minutes.
2 minutes. And then how many times a day?
Twice.
All right. And then that was really good. I'm glad you're still using that technique that we talked about. And then do you mind showing me how you floss at home now? Since we went over that last time. And then you lightly slide it in. And you do C shape. Okay. And then do you know why we floss?
To remove plaque and bacteria.
Yes. Okay. And then you make sure that you do it throughout the whole mouth.
Okay.
Perfect. So you did really good on that as well. And then, so today your plaque score was a 1.3, which is considered good. So you went down a whole 2 points from the last session. So that is amazing. I really think you're doing a really good job so far. And then your bleeding score was a 36, which is still like a little bit up there, but way better than the first time, because the first time it was a 62. So I could tell you're using your techniques at home. So I'm really glad that you're doing that as well. So I know at the first appointment you had 3 caries lesions. So it was, I'll just show you on here, it was on tooth number 3, and then on 14, which is on this side, so it's on your molars, and then 19, which is right here. So I will say all the caries lesions were on your molars, which is kind of pretty common. And then do you mind telling me your daily routine now?
Yes, so I brush once in the morning and I floss, and then I've stopped trying to stop eating so many sweets, stop drinking so much coffee and soda, and then I brush at the end of the day, and sometimes I'll floss at night.
That's really good. I'm glad you're taking this at home, because a lot of people usually go to the dentist and we tell them how to properly floss and brush, and sometimes they don't do it at home, but I could tell you're doing a really good job. So really good job on that. Okay, so I know we're going to go over the last few appointments because this is our last one, so you've been doing a really good job. So the first appointment, that long-term goal was to decrease and maintain plaque score to 0.5 or less by March 30th, and you were slowly but surely getting there, so you've been doing really good on that. And then there's 3 short-term goals for those. It's having an understanding of what plaque is, and able to define plaque. So do you remember what plaque was?
Build up in your teeth.
Yes, build up in your teeth from that bacteria, right? And then so the second long-term goal, or the short-term goal, it says decrease plaque score by 1.0 or more each visit, and you have been doing that, so really good job. And then the last one for the first session, it was to demonstrate proper brushing techniques, which you already did, and you did the first session, so you've been doing a very good job. And then the second session, we talked about periodontitis, and we talked about flossing. So that long-term goal, it was halt the progression of periodontal disease by reducing the bleeding score by 0% by March 30th. So we've been getting there, so that's really good. And then the 3 short-term goals, it's understand what periodontitis is and the cause of periodontitis. So can you tell me what you remember from that last session?
I remember that it's caused by not brushing, bacteria, buildup.
And then also periodontitis is irreversible or reversible?
Irreversible.
Yes. And then that we also know that it involves bone loss, and that's why it's irreversible, because you can't gain that bone loss back. Okay, so now we're going to look at the 3 short-term goals for periodontitis. So we, in the first session, it says to understand what periodontitis is and the cause of periodontitis. So can you tell me what you remember about periodontitis?
Yes, it's bone loss that happens over time, and it's caused by bacteria buildup, food buildup, and it's irreversible.
Yes, good job. And then it says to reduce bleeding score by 20% at each visit, which you have been doing. So I could tell you've been doing that as well. And then demonstrate proper flossing technique and start flossing once a day. And you already told me that you have, and you showed me. So you've done a really good job. Okay, so for today, we're going to talk about caries. Do you know what that word means?
No.
Okay, so it's another word for cavities. Since you do have 3 cavities on your molars, we're going to talk about that today. So the long-term goal for today is have carious lesions restored by March 30th. And then the 3 short-term goals, it says, the first one, it says to understand the cause of caries in relations to the diet by today. And then patient makes an appointment with the dentist for caries restoration. And then patient begins to use daily fluoride rinse as well. So we're going to talk about fluoride as well after that. Okay, so what is caries? So caries is an area of tooth decay that happens when minerals are lost from your tooth surface. And then you see how it's losing that enamel from, or it's losing minerals from these spaces right here.
Yes.
And you can tell like a lot of these are in the molars. So it is pretty common that it does happen in the molars. And then it also starts as demineralization of enamel and dentin and can become visible whole, as you can see right here. Or if the cavity is untreated, it could create that. And then, do you know how caries form and what it does?
No.
Okay, so caries is from bacteria, so it does come from like sugars, carbs, like the stuff you have been eating, but you've been getting better at that. And then it also has acid attacks that last about 20 to 30 minutes after eating / like drinking sugary or starchy foods, showing like why controlling plaque is really important to prevent caries process. And then like over time, the damage does spread deeper into the dentin and may reach the pulp. So and then it leads to tooth decay, and that's why you can tell right here that it's creating that hole. It's kind of black, brownish. And then it is due to like poor hygiene and the sugary foods and drink that we talked about. And then do you know like the treatment options and like what may occur without treatment?
I know you're supposed to fill them, but other than that, no.
Like going to the dentist and getting them filled. Yeah, you can. That's a really good thing. You can also do that. Go to the dentist. They can fill them. And then earliest caries can be reversed though with fluoride, and we're going to talk about that later on. And then it also you could prevent it by brushing regularly and properly. And then advanced decay needs fillings, as you said, or like dental work. And then without treatment or treatment plan, pain, infections, or tooth loss can occur, but you have been doing really good using your techniques. And then the infection could possibly spread to surrounding tissues as well if you don't do treatment. And then, do you know how to prevent caries?
By like brushing every day?
And using your flossing techniques as well. And then using fluoride as well, but we're going to talk more about that later. And then you limit your sugary foods and drinks, which you said you have been doing. And then regular dental checkups and professional cleaning, stuff like that. And then you want to make sure you also use fluoride rinses or treatments to strengthen that enamel as well. And then can you tell me what we learned about caries?
So it's cavities, and it can create like holes in your teeth if untreated. It's from like not brushing, poor hygiene, sugary foods, starchy foods, and sugary drinks. And it can decay out your teeth, but it is preventable and curable.
Yes, very good job. And then now we're going to talk more into fluoride since we already kind of touched on it a little bit this session. Okay, so now we're going to talk about fluoride. So do you know what fluoride is?
I've gotten it before, but I'm not really sure what it is.
Yeah, fluoride. So it's like a natural mineral and salt form of fluorine found in the body. So it can be found in your teeth as well. And then it's stored mainly in the bones of your teeth and helps keep them like strong. And then do you know like the purpose and like the benefits of fluoride? Okay, so the purpose is to protect the teeth from decay and makes the enamel strong in your teeth. And then it prevents cavities and it fights those acid attacks. And then The benefits, it decreases risk of tooth decay, it can reverse early damage from those acids, and then it strengthens the enamel and it keeps the teeth healthy and protected against bacteria as well. And then, do you know what demineralization and remineralization is?
No.
Okay, so demineralization, it's an early stage of tooth decay, and it's minerals like calcium and phosphorus that are taken out of the tooth acids and it's made from bacteria. But remineralization is a healing process where lost minerals are replaced, and fluoride helps rebuild and strengthen the enamel, making it even stronger and then before and less likely to develop new cavities. So, do you know where fluoride is found or where a patient may receive fluoride?
No.
Okay, so it's found in food, salts, and water, but the food usually doesn't have enough fluoride to help prevent tooth decay, but also bottled water does depend on the brands such as Ozarka and Arrowhead, and it can also be present in instant formulas and some water filters as well. And then it's also received through toothpaste, mouth rinses, professional treatments, such as gels, foams, or varnishes applied during dental visits. And then, do you know what we learned in today's session about fluoride?
So it can help prevent tooth decay. It's found in some certain waters, some foods, and some instant formula. And it can come in different forms, like through treatments or the
Like
other
with
the waters
gels,
and
foams. Yes. Okay, so we are finished with today's session. So long-term goal for today, have caries lesions restored by March 30th. And then the short-term goals, it's to understand the cause of caries in relations to the diet, which you already talked about caries earlier. And then patient makes an appointment with the dentist for caries restoration, which we will do that as well. And then patient begins to use daily fluoride rinse by today. So do these goals seem attainable to you? Okay.
Yes.
Okay, so today was our last session, but I will make an appointment with the dentist for you to get your caries restoration. And then I will set up a recall date in about 2 to 3 months. That would be like March 2nd. Does that sound okay with you?
Mm-hmm.
Okay, and I'm also doing that just to make sure that you're still using your techniques and properly brushing your teeth as well, and just making sure that you're keeping up with it, which you have. So I just, want to be sure. And then, do you have any questions for me today?
No.
Okay, so it was nice seeing you, and I'll see you in about 2 to 3 months.
Okay, thank you.
Yes, ma'am.